April is Oral Cancer Awareness Month. The American Academy of Oral Medicine estimates that the disease kills one person every hour of every day. Although the average age of contraction is close to retirement age, oral cancer has seen a spike among younger people, largely due to smoking, tobacco, and the HPV virus. An estimated 50,000 people will be diagnosed with oral cancer this year. Its high mortality rate is largely due to late detection. Because of this, dentists make it a point to look for it with routine checkups. Dr. Kenneth Cohrn of Heritage Dental tells us how they examine for oral cancer.
Oral cancer. There is something like 35,000 cases of oral throat cancer diagnosed each year with the average onset age of 62. So this is a big part of our population. When patients come in for their examinations, we always do an oral cancer screen. Now, the patient may not be aware we're even doing it because it's usually at the end of the appointment, and we'll look at the tongue and throat and the gingiva and everything, and we do this as just part of the treatment, so they may not even be aware of it. And every dental office should do this. So if we see something that is out of the ordinary, typically it's one-sided, it's not both sides, but not always, we'll question the patient. Have you seen this? Has it been here a while? Are you aware of it? Does it hurt? Does it bleed? Is it swelling? And if it's a lesion that is suspicious, we can either biopsy it here and send it out, get the result, or more often than not, we'll send it to an oral surgeon, and the oral surgeon will take that, because if it is a lesion that needs to be removed, the oral surgeon's going to do it anyhow, so we can save a step. So we look for, like I say, ulcerations, swelling, one-sided lesions. It's amazing what sometimes people will let go by and not even look at it. I can remember a case, I had a gentleman in a few years back, no teeth. And I said, I think we should take a pan-oral x-ray just to see. He goes, no. I have no teeth, I have no pain, I have no swelling. I convinced him of it. He had a lesion that started here, went down his entire jaw and over to here. Any kind of a blow to his jaw would have fractured it. He had no symptoms. So just because there's not a symptom, there's not pain, there's not swelling, doesn't mean that there's not a problem. When you go to your cardiologist, you don't tell him not to take an EKG because you're not having heart discomfort. It's part of the diagnosis. It's for your good. The prognosis for oral cancer depends on the type, where it is, how long it's been there. Oral cancers in general, though, tend to be serious, especially when they manifest themselves as swelling and so forth. So certain cancers are more aggressive and dangerous than others. So that's why early diagnosis is important.
You'll find information on the services provided at Heritage Dental, serving the Villages and the Lady Lake area, when you click the Oral Cancer Story Link icon on our homepage at yourhometownhealth.com.